1, 2, 3.
So, hi, everybody.
Hi, Margaret.
Is everybody here?
Waiting on.
Oh,
Ben.
yeah. Just for Ben, is it? And Mel.
Mel's
Did
just
you get
connecting.
sorted, Mel? All right.
Just to let you know, we're live streaming the meeting to YouTube.
Oh, right. I'll behave. We'll just wait for Ben a few more minutes. Is that okay with everybody?
Yeah, I dropped him a message as well. Make sure he's noticed to come on.
Right, yeah. If it's not here in a few minutes, we'll just best stop, aren't we? If we're live streaming, it wouldn't seem right. If we start with introductions, then, if I start first by introducing myself, Margaret Parker, the chair of the board, and if I start on this side, where I want to go across. So, Claire, for yourself.
Hi, I'm Claire Birch, and I'm the Information and Communications Coordinator at Healthwatch Rochdale.
Rob.
Hi, I'm Rob. I'm the Operations Coordinator over at Healthwatch Rochdale.
Stephen.
Hi, Steve Sanderson, board member, experience in management and key business processes, etc.
Thank you. Mel.
I'm Mel Tunney. I'm one of the Healthwatch board members.
Kate.
Good evening. I'm Kate Jones. I'm the Chief Exec of Healthwatch Rochdale.
Right. David.
Oh, David Bradshaw, I'm the Treasurer. I'm still struggling with my camera.
That explains why I can't see you. Thanks very much.
I've had to turn mine off because of bandwidth problems here. So.
Oh right, that's a pity. Never mind. The first item on the agenda, if everyone's got that in front of them, is questions from the public. Now, we have got quite a number of questions, and the last time I actually took the time to read them out, but they are quite extensive. And I'm just wondering, Kate, is that necessary in each case to do that? And because we are going to go on the website, I don't know whether the rest of the board members have seen the latest list of questions, but if I just highlight the fact that there are 2 questions in terms of patient data survey, 1 question in relation to mental health, and 4 questions in relation to Black equality organisation research. And I could read out the questions, but they are quite long and quite extensive. So is that okay? We just record that there are those range of questions, and that Kate, there will be responses going on the website formally.
Yeah, so, and also I just wanted to add in here, some of these questions are coming in quite late towards our board meeting. Therefore, we're not able to get the answers ready for board, unfortunately. So what we are going to do is we are going to update our website in regards to our public question part of the meeting, and ask that any questions are submitted to at least 2 weeks prior to the board meeting. If not, they will have to roll over to the next board meeting. It's just not manageable from a staff perspective. So we'll make those amendments, and but we will obviously put the copy of the questions and answers onto the website, and we'll do some social media so we know they're out there.
Right, thank you. I do acknowledge that, because the lateness of this is I actually got them very late yesterday, and so that shows how hard it was. And I understand, speaking to Rob earlier on today about the questions, that in fact there's been a lot more questions have come through, and you've had to spend a lot of time sifting through as well in terms of the ones that are relevant for our board meeting. So I do acknowledge the time and effort that the team are putting into this to make sure we do respond effectively. If we now go on to the minutes, then has everyone had a chance to read the minutes? Everyone okay with them as a correct record?
Yeah.
Thank you. And there was, as far as matters arising, anyone had any other matters arising from it? There was one matters arising, but I understand looking through the rest of the agenda that is listed on the action log, so we don't need to refer to that now. So we go on with that. Declarations of interest. Is there anybody that needs to have a declaration of interest in the rest of the agenda? No, right, thank you very much. So we go on to the action log, Rob, if you could pull that up.
No problem. Let me just share my screen. Hopefully you can see that.
Oh, it's not a long list, is it? It was about the report, predominantly then to do with the report that was a changed style of report that we've got from the advisory group, and that we've not actually done a formal review of that as a board, but I know that we've talked about it informally, and I felt that we came to the conclusion that it was now in a format that we related to better, and we found it more accessible and easy to reference. Would other board members agree?
That's my understanding.
And so therefore, could we agree that we have that as complete? Yeah, thank you. We'll move on to the next item. We're doing well here. The advisory group report, that fits in nicely. Are you going to talk to this, Kate?
Yes, I am. I'm just,
right, thank you.
Rob, you're sharing your screen at the moment.
Yeah, that's great. Yeah.
No. Do you want, I'm just going to bring it. Do you want me to bring the report up for you?
Yeah, if you don't mind, please.
Yeah,
thank you, Rob.
No worries.
Okay, so board members, you have received a copy of this prior to the meeting, but I'm just going to talk through it just with it being a public meeting.
Yep.
So in regards to our monthly meetings of the advisory group, we are currently pulling out key themes through our data intelligence and then deep diving on pieces of work. And that's how the decision-making policy within the organisation is now set up. So the current key work areas identified from our data intelligence, we've got work with local menopause services at the moment. So we've received a lot of feedback in regards to gaps services relating to the menopause and perimenopause phase. And we are engaging with local women at the moment and stakeholders and local services. We've currently got an online survey, and we're trying to get some focus groups up and running as October is Menopause Awareness Month. And the idea is to really get patients' journeys, hold some conversations and see what's missing out there in regards to that patient journey, specifically to menopause services. So next one is the local pharmacy services. So there's been a lot of concerns raised locally that highlight that Rochdale residents are having problems with pharmacy services. And we've done some deep dive in regards to social media campaigns around feedback on this. And we are currently out for, again, a survey asking for more information relating to this. There's lots of changes that have been happening across the health and social care arena, but specifically pharmacy, in regards to specific delivery of medication, repeat prescriptions. A lot of people are having issues. And also this has been highlighted at a Greater Manchester level, and there's some work being done across the Greater Manchester Partnership to improve and standardise some of these pharmacy issues. Another big one for me within the Rochdale Borough is the fact of the Minor Elements Scheme, which is, for those that don't know, is a local scheme which enables low-income families to receive medication through the pharmacy rather than having to access the GP directly. Unfortunately, in Rochdale, there's minimal services that are signed up to this. And obviously that is a really bad equality impact in regards to local residents. So local patient participation groups. So we've done a deep dive into local participation groups, which are attached to GP practices. So all GP practices are commissioned, which means that they are paid to deliver on providing patient participation groups. And these groups are utilised to for the practice to engage, to make sure that decision-making is in line with the patient involvement. Now, since COVID, the PPGs have been stepped down. And unfortunately, across the borough, there's a really low uptake into them being set back up. So as a local health watch, this has been brought to our attention. So we did a deep dive and we rang round, and it was quite surprising that a lot of people didn't actually know what a PPG was. And that was from their, the first point of contact within the GP practices. There'll be a formal report created, hopefully by the end of next week. I'm just waiting on some local information from the primary care commissioning team to show what practices are up and running in regards to the patient participation groups. And we'll be holding the commissioners to account from because they are being paid to deliver on this in regards to ensuring that PPGs are re-established and the support given by the commissioners to get them back up and running. Next in the report, we looked at our local GP websites. So this work has been ongoing for quite a while now. We reviewed all the GP websites across the borough, and we've held some focus groups now looking at what a fantasy GP website would look like for patients across the borough. And we engaged online with 8 people, and we held an event with support from HMR Circle with 30 people over the age of 60 to discuss what a website should look like for them. So this is an ongoing piece of work. I'm working with the commissioners in Rochdale who deliver on the websites to look at how we can create a new template. And I'm actually attending a meeting on Friday to deliver some of this work and give them an update. We're due to go out for a survey in the next week in regards to a bit of a further deep dive around what people want from a GP website. But we're also going to engage with local GP managers. And I've got a meeting booked in to attend the GP managers forum to give them an update on this piece of work and to find out what would help improve, you know, for them in regards to the website usage. So they're the key areas of work that we're working on alongside with our advisory group. And like I said, they've come through the data analysis that we do on a monthly basis. So just to give you an update in regards to the red flag issues that were raised in the June board. So there was the external collaborative working relationship, and really just to reassure the board and Joe Public that we are now in the right places for the meeting attendance. All of them are slowly but surely coming into place now due to the changes across the health and social care system. So just to reassure obviously the board that the advisory group are aware of what those meetings are now being attended. The next one was no clear offer for local health and social care organisations. And it was really just to highlight there that our data is now being reviewed. We've got an insight report on the agenda further down in this meeting, and we are feeding our data into various sets. So not only was it raised as a red flag issue and it's now been resolved, we've also had massive impact in this area because where our data is going now, we're feeding into the system so much more, and it's enabling that patient's voice to come through. And then finally, internal staff structure and support. So concerns were raised in regards to the support and how everything almost sat with myself as the CEO around the advisory group. There's been a review of all our documents relating to this, and it's under part 2 of our board agenda, where we'll review the documents and discuss them. And then there's a new process in place to make sure that the work is eased on myself and it's more distributed across the organisation. So just to scroll down slightly, please. So public concerns for Q2. So key issues, access to services, particularly GP. We know this is an ongoing issue, and we're looking at website work to try and see how we can overcome some of these initial battles. We've got medication, and we've got increased feedback coming through around medication. And again, we're doing some work on that, looking at pharmacy work. So poor communication. So the moving on service is still an area of concern for the advisory group. However, we've had some really positive meetings this week with Rochdale Council Adult Social Care Services. The service, as the conclusion around the service has been determined, and that's not going to change. However, the building itself is under review, and the council are looking for services to go in there. But what we're going to do first and foremost is go and engage with local residents and wider, broader Rochdale residents to see what people want in that building in the Alkington area. Number 4, we've got unmet needs. So we've got some concerns coming through around hospital follow-up on discharge, poor antenatal support, bereavement support. So we'll keep an eye on this data coming through and reporting to you guys if anything more comes around there. So for consideration by the board, we've got 2 things. So really just to make you aware that the key documents have been reviewed, and obviously they're at the part 2 of this board meeting this evening. And then the second one that was just to let you know that the November meeting will be stood down as a standard meeting, and we're going to be running a development session, reviewing all the documents again, and looking at how we move forward in regards to an action plan relating to our strategic plan for the advisory group. And just to say that board members are more than welcome to join us on that. That's all from me. If anyone's got any questions.
Right, thank you. Any questions, any points anybody else wanted to raise at all?
Only that in my business, where people were struggling to get medication, we were advised to use a business called Pill Time. And this is so any member of the general public can send their prescription off to this company called Pill Time, and they post all your medication through the post on a roll. So if people are really struggling to get medication, maybe the best solution is to start hitting the pharmacies with losing business and send it to this company Pill Time. It doesn't cost anything to the person that's got the prescription. It's just a different way of doing it.
Interesting.
So have a look at something called Pill Time. I've got some, I think I might be able to, I can't say that I've ever used them, but I might have some marketing information on it. And it is an alternative via Royal Mail, I think, to pharmacies.
Yeah, be useful information. Thanks, David. Any other questions?
I didn't specifically want to question, just want to acknowledge that I feel that we're doing, it comes over very well about the level of detail work that's going on in the advisory group now, and the deep dive seems to be very pertinent in terms of where we are. I was going to raise a question, and you've reassured me a little bit about the fact that some of the outstanding issues are moving forward, like the moving on service. Are these actually outstanding because they've not been actioned, or have there been further issues raised against each of these points? That's what I wasn't clear about in the report.
So in regards to the moving on, the delay in the moving on is because the service hasn't been finalised almost, because the service has changed so much of what is now being delivered in Alquinton. It's not the moving on service, that doesn't exist anymore. So they've got a building, they've got a building with quite a lot of space. Now, because we've said we'll go out and do the engagement independently on the back of our moving on report that was, 18 months ago, the delays are due to system delays rather than our delays. And actually, the council were asking us to hold off, but now they've realised that we can go out and do the engagement anyway. So it has been the council delaying it. Just due to, I mean, there's a new building coming up in Langley in the new year as well. So I think they wanted to sort of like tie some of that engagement all round. But actually we've said, this is an Alquinton building, let's engage with the demographics there. So that's what they've decided to do. So no, it's not that we've delayed this piece of work, it's been delayed due to system changes.
No, I didn't, sorry, I didn't want to imply that. It was more about the fact, it was more about the fact that these have been the same things reported from the last quarter. Is it because they are repeating small numbers of people coming through that it's again on here, or is it that we haven't got enough information to actually challenge some of these things?
I think it's the lack of information coming through. I mean, obviously, as an organisation, we have to consider capacity, and
that's what I wanted.
And if you look at sort of like the four top key areas that we're doing within the advisory group at the moment, they're additional. They're deep dive pieces of work. The other areas that are coming up, like slow discharge, we will just continue to monitor them and review them in line with our decision-making policy. So if we're getting enough feedback, we might raise an escalation, informal or formal, to commissioners, providers, to try and gather a bit more information. But at the moment, we've got to almost put them on the side burner while we deal with these pieces of work that we're looking into. But they're on our radar, and we're keeping them on your radar. Yeah,
that's helpful. Okay. Thanks very much. Any other points? Any questions? Anybody else wants? Thanks very much indeed, and thank the advisory group for the work they're doing on this. Appreciate it.
Thanks, Margaret.
So, shall we move on to the next item, which is the quarter staff update? I was looking forward to this. To you, Claire, first.
You ready, Claire?
Sorry, I was just tweeting.
Oh,
Right, okay, if we can begin then, Rob. Sorry, I'm struggling to see that a little bit. So the first slide is, can we make that a little bit larger, Rob? Can we do full screen?
It's full screen on mine.
Is it full screen on yours?
Yeah.
Let me just change my view then. That's better. Yeah, thank you. Right, okay. So first slide is website update. So the update is from the 19th of June to the 19th of September when I created this report. So we had 2,913 visits to our website. So that was a 19% increase from our last report, which took place last quarter. And if you can see on this chart, obviously where we had quite a hit in our first period there, that's when we was out for recruitment. Then we dipped back off again after our recruitment finished, and we've gradually been climbing again on each quarter. Of those visits, we also had 2,193 people who came to visit. So the people are sometimes less than the visits, because a person may come to visit our website more than once. But again, that's a 33% increase on last month. The top pages that were visited were our homepage with 960 views, our recent recruitment with 255 views, and interestingly enough, our contact us page with 243 views. I think that's the first time that's ever been up there. So yeah, next slide, please, Rob. So where do our website visits come from? So 43% of people who come to our website come through organic search. So basically that means they put something into Google, such as how to find a dentist, can't get a GP appointment, and our website comes up in the index, and they'll click on it. That's normally through our advice and information pieces that we put on our website. 34% came directly, which means they had a direct link, mainly www.healthwatchrochdale.org.uk. 16% of our visits came from social media. So 300 people clicked a link on Facebook to our website, 43 on Twitter, 14 on Instagram, and 7 came via LinkedIn. And there was also 7% came referral, which means a link on another website that has then directed them to our website. Next slide, please, Rob. So these are some of our top social media posts. So we tend to have different audiences on Twitter and Facebook. So on Twitter, interestingly enough, all of our top posts were regarding other organisations' information. So we had a safeguarding tweet regarding honour-based violence. We had a survey about smoke-free spaces in Greater Manchester. I think that was a hit because you could win a £100 Amazon voucher if you took part. And we had on Sunday the 4th of September, you could visit Neely Mosque as part of the Visit My Mosque initiative. Next slide, please, Rob. On Facebook, it's a bit more personable. This is where we tend to have more of our residents. Twitter is more of our professional audience. Facebook is more of our local residents. So our top post was our recruitment, which obviously is always popular. And then we had our Youth Watch day out at Puttstars Golf Club, and then welcoming Judith to the team. And this was our first post welcoming her. Next slide, please, Rob. So feedback. So over the last 3 months, we've had 129 pieces of feedback. So of those feedbacks, we've had 12 were mixed, 72 were negative, 10 were neutral, 31 were positive, and 4 were unclear. As you can see, there's quite a broad spectrum there. So what we're trying to do now as a team is standardise that a little bit more. So we tend to have just sort of positive, negative, and mixed, so that we can all we can see it a bit more clearly as to our trends. So how did we get our feedback? So we got 33 pieces through email. We got 40 pieces through our face-to-face engagement. 12 pieces came through meetings, 17 on the telephone, 1 via a third party, and 24 came through our website feedback form. We currently have 2 surveys live, as Kate mentioned before. We've got the menopause survey and the pharmacy survey. We're currently at 69 responses for the menopause survey and 46 responses for the pharmacy survey. We've also got quite a few people who want to speak to us in more detail and join our focus group for the menopause. Next slide, please, Rob. So signposting, we made 107 signpostings. So the top areas where we signposted people to were Rochdale Advocacy Together Hub. That was 18% of our signposting. So that was for help making a complaint about an NHS service. Then we had 10% to NHS 111 and 7% to NHS Find a Dentist, alongside 7% to patient services in Hayward, Middleton and Rochdale Integrated Care Partnership. Next slide, please, Rob. That's everything. Is there any questions?
Can I just come in?
Yeah.
It's not a question, sorry, it's more of a comment. Just to say that I had some really positive feedback in regards to our comms that are going out at the moment, especially around our press releases and around the Freddie Award, and just to highlight that that's been put into a lot of the local newsletters this quarter. So I just want to say, Claire, really good work. Thank you very much.
Thank you.
Thank you. And I've just realised, Judith, you've joined us. I'm sorry about that. I didn't start the meeting. Welcome. I'm pleased to see you. Do you want to do your little piece now?
Can you hear me?
Yes.
Yeah. So I'm a Jews driver. I previously worked in education and left education, needed a new challenge, and here I am and enjoying every minute of it. It's wonderful to have been welcomed so warmly, and yeah, I'm loving the new learning that I'm doing. Learning something new literally every day. There is a lot to learn. I feel a little bit like a sponge at the moment. I'm just soaking everything up. I don't quite know what else I can say. I've enjoyed looking at the surveys that we've been doing. Of course, this is all new to me. Surveys aren't, of course, but actually working out there with the general public and asking them their thoughts. And I was quite shocked, really, at the amount of people that are quite, well, I don't know, quite upset really with the survey, with the services that they're getting, with the GPs. A lot of that actually is also coming from how they feel they're treated with receptionists and things. That quite amazed me, really. I'm enjoying looking at all that information, and Claire analyses everything so well, and Naomi's been absolutely brilliant with me. So I feel that I've joined a really super team with Rob and Kate. It's absolutely fabulous.
They'll give you your rewards afterwards, Judith. They'll really appreciate that.
Thank you. Yes, that's a little bonus. Yeah, I mean, just really enjoying my first 4 weeks. It's been absolutely super. I hope it continues. Really made so welcome. Can we have the next slide, please, Rob? We were made so welcome at my very first GP focus group with the HMRC Circle. It was a really lovely group. Lots and lots of positive feedback. Lots of good conversation about dentists, pharmacies, hospitals. It was absolutely brilliant, and it was so nice to be so warmly welcomed. So that couldn't have been a nicer group to have started my work out in the out there with everybody. It was absolutely fabulous at my first focus group. I've done lots of training. I've read lots of policies. I've been on training this afternoon, looking at the how the care system works. That's been absolutely fabulous. I've had some really good feedback there with some of the comments I made, so I was really chuffed about that. Yeah, just I suppose really my thoughts about I'm passionate really about homelessness. It's a worry to me, and I think you know, it has been for years, how people find homes and how they manage to keep the homes and how mental health affects people from the homes to then become homeless. It becomes a vicious circle, and it's one of my passions, really. And of course, that has a massive impact on the health of the population of Rochdale, because obviously Rochdale has quite a large homelessness problem. So it is one of mine. I'd like to try to do some work around the homelessness and health and how that affects mental health. If we could, if that fits in with any of the agenda in the future. But yeah, just really loving it. It's fabulous.
Great, that's lovely to hear. Thank you.
Thank you.
And
thank you, Margaret.
Oh, Naomi.
So I'm being Naomi for a minute.
Oh, right.
Unfortunately, Naomi's got another meeting this evening, so she weren't able to attend the board with us moving the dates and times around. So you've got myself. So I am going to be whizzing through these. So these are our volunteer statistics. So a key area what we're looking at moving forward is trying to engage with Heywood residents to bring some Heywood voices onto our books to ensure that we're covering that. Also, just to say that the advisory group, obviously once the documents have been reviewed, we will be going out to recruit and quite a heavy recruitment drive on that. Our Youth Watch is forever expanding. We've got 3-4 new members over this last quarter, really positive, and the work that we're doing locally is being recognised, and we're working in with a lot of partnership and collaborative working. And just to say that we'll be going out for board recruitment also after the new year. And then finally, we are due to start our enter and view programme again from December. So we will be going out to re-engage and re-recruit for enter and view volunteers. That's part of our work programme to start from December and get back out there doing our enter and view programme. Next slide, please, Rob. So Youth Watch as a whole, it's a really busy time for coming into September now, but it was a bit slow over the summer for us. We had a session which we applied for some funding from Action Together for our youth people to take them out for the day and thank them for the work that they put into the organisation and the volunteer time. So that was a really successful. We had 7 people turn up. Some of them brought a friend, and now those friends have actually signed up to Youth Watch after Naomi twisting their arm up the back, shall we say, like she does. Yeah, so we've got our Youth Watch 100. So our Youth Watch 100, for those that don't know, is a monthly survey, and it's a chance for us to engage with the youth on quick fire questions, to gather feedback, and where appropriate and when we can feed that into the system. So over the last quarter, we've looked at sexual orientation and gender identity. We've done some work around education, and for every Youth Watch survey that people respond to, they can sign up to be put into a prize draw. So it's £20 voucher every month on the back of these surveys. So we do want to work on this data a little bit more, and Claire's been putting some time aside to deep dive into some of this youth data to see where we can be feeding it differently to our feedback and our patient journeys. So that's something that we're working on, and hopefully we'll have a better update for you at the next board meeting. So like I said, we have a monthly meeting and we're constantly recruiting. Naomi's doing some work with the schools to make sure that our merchandise is out there and our posters are out there so that people can scan our QR codes and sign up and get involved in what we're doing. Throughout the summer, we've done some partnership working, looking at the safeguarding, SEND teams and the Children's Commissioning Services. Next slide, please, Rob. So this is just a picture of our Put Stars Award. They got pizza, and it was a really good session. And just to really plug out there, Put Stars, I don't know if anyone's got children or grandchildren. It was a really good environment, and the kids that came had a really good time. Next slide. So we've got our Q2 highlights. So Naomi's been out and about, really busy in the last quarter. Obviously, we had recruitment drive out for community project worker, and we've got lovely Judith joined our team now. However, Naomi was covering a lot of the engagement on the ground, which had previously been booked in. So she's had a busy summer on the ground, and that reflects in our face-to-face feedback that we're receiving, which is really good. So Naomi's been out there looking at attending lots of virtual meetings, grassroots, community and faith network, women's network, which we're working really closely with on our menopause work, and Health Watch England engagement leads. In person, attended the Voluntary Sector Partnership, which is a new big meeting that's just been set up across the borough, which is led by one of the local councillors. And it's a real opportunity for the voluntary sector organisations to come together and look at how we can work better across the borough. Holding the line against poverty, the Women's Wellbeing Cafe, hashtag Thrive Girls Group and Mind. So Naomi's been out engaging with these various people. We have our regular information, advice and signposting. So this is some of the work that Judith will pick up as of October. Now she's been inducted into the organisation. So we have our regular 5 sessions across the borough, and they're listed at the various locations. We're there same time every month. So, you know, people can come to see us if they need, you know, information on anything, if they just want to talk us, you know, give us that feedback, we're there to support. Some of the places that things that Naomi's been doing is getting out and about in regards to the Women's Supper Club, and that was at Touchstones. We held a arts and crafts event in the summer, which was really, really positive. There was free space given by Touchstones, which is the museum in Rochdale, and we had quite a few footfalls through the door, sitting down, being creative, decorating pebbles, making pom-poms with our volunteer Elizabeth, just gathering feedback and talking about general health and social care services. Next slide, please, Rob. So this is just to highlight some of the areas that we've been involved in within the last quarter. So what is Rochdale Community Event? So that was an ESOL Rochdale, and don't ask me to say what that means, because I've not got my abbreviation with me. So there was 132 attendees from a wide range of demographics, and it was a bilingual event for volunteers. Health Watch raised awareness of our services, so Naomi's getting out there and speaking to people at these big events. We've had the GP focus group, which we engaged with 27 elderly, and obviously we had the online focus group previously. Rob, next slide, please. And then we attended the Coffee Rockers, which is a home instead event, which was a really positive event. Both, I think Judith did attend this one, came back and were really, really blown away by the engagement and the conversations and the staff at home instead. So it was a really positive event, and we're booked onto a few more of them over the coming months. And then finally, the Money Max Roadshow, which was at Middleton Arena. And again, it was about feedback, discussions around data costs, paying for services, looking at our volunteer side of stuff as well. I think that is everything. So just to make you aware, normally, Rob, if you want to stop sharing the screen, thank you. Normally, Rob would come in now and give a bit of an update in regards to our impact. However, Health Watch England and Health Watch Rochdale have currently been reviewing our impact tracker, and we've got a new one put in place. So what we've decided to do is not deliver on that this time round, and actually give you a full update in December and show you the new impact tracker and talk you through it, so you've got a better understanding of it. We are making impact still, so just to make you aware of that, and you can see that through the, you know, the contents of the updates today. And then the one final update I just wanted to give was just to remind you all that we've got our open day booked in for the 14th of October, Friday the 14th of October. So that's a chance for professionals across the borough and Rochdale residents to come, and we're showcasing our work. So just to really plug that. Thank you.
Anybody, any questions, observations, anything on that? Once again, helpful update for everybody. Thanks very much indeed. Appreciate it all. So if we go on to the next item then, if everyone's okay with that, and it's the insight report. Does that mean Rob's got to bring that back up again?
Yeah, please, if you don't mind, Rob. Sorry, it's me again. So the insight,
everybody had a chance to have a read of this, hopefully, but it is about the importance of making sure that the public know as well. Again.
Yeah. So, well, this is a new report that Claire has created, and the idea is to show themes in our data. We receive so much data, and it can be difficult because it's a personal experience to try and show how that data can be used. Hence the fact that we are increasing our surveys. So this new report really identifies, Rob, sorry, can you just go to the next slide? It identifies the data that we've received for June, July and August 2022. So it shows that we've received 105 pieces of feedback. 64 pieces were negative and 23 pieces were positive, 13 pieces were mixed. And that's what Claire was alluding to before when she said we're going to stop using all the mixed positive. We're just going to use those 3. So key area around our data, GP and dentists. So our GPs and dentists made up 60% of the data we received for the month. And then roughly 60% of that data was about GPs and dentists was negative. In total, 34% of that were about GPs and 24 pieces of the data were about dentists. So that's just to give you an idea of how much we are receiving specifically around the data and GP issues. Next slide, please. So who's given us this information? So from the data that we have received, the feedback that we've received, out of all that data, 45% were female, 28% were 25 to 49 years of age, 8% of them identified as white British, 36 heterosexual, 28 living with a long-term or disabled, and 10% of that feedback was from carers. So we're just really trying to identify and inform you guys of where we're getting our data from. And I think it just means that if we are seeing correlation in our data and trends, that we can actually look at our demographic side of things as well and start doing some deeper work within our grassroots of our communities. I think that's really key. So in regards to, this is just a slide to show you the breakdown in regards to the positive, negative and mixed feedback that we've received on those 2 areas. Next slide, please. The key themes in our data. So we understand the thematic analysis of our data on a quarterly basis to identify priority issues in our most recent data. It's not possible to provide precise figures, and that's because of the format of the data. Instead, we give an idea of amounts by using a colour coding system. So this is the way that we will start to deliver to within the public domain our data sets. So as you can see there, huge, lots, some, and a few. And just to let you know that this report is a standardised Health Watch England report, which we have tweaked for our usage. Next slide, please, Rob. So I'm not going to go through all of the comments in the slide, but throughout the document now, you can now see that the pink, so it will receive in larger amounts of feedback on it, and it's difficulties in getting appointments, access to NHS dentistry. Next slide, sorry. So the green, so not as much. So we've got children, adult and mental health services. And like I've said previously, when I mentioned about the advisory group report, these are areas that we are keeping an eye out for to make sure that, you know, we are monitoring how much feedback is coming on in these areas. And then pharmacy, we're already doing a piece of work on that, but that's still one of our key topic feedback areas. Next slide. And then outpatients, again, it's what we've alluded to in the advisory group report, because obviously they review our data. And then just to say that we've also received small amounts of feedback about maternity and various other services. So as a whole, this is, like I said, it's a new report, and I just thought it'd be something to bring to the public board on a quarterly basis to really identify. It's the first time we've done this report, so we appreciate that some tweaks might need to be made, and we might need to look at formatting things differently and delivering things differently with more wording. But really, I'd really appreciate any feedback that you've got on it and how you found it in regards to delivery. Right,
I'll hand out before I make a comment. Anybody want to make any observations or comments about them? Yeah. I personally welcome this, Kate. I think that it's useful for us to have this sort of information coming to us and gives us a feeling of what's coming through. What I didn't get, and I wasn't sure, are these direct contacts with us, as opposed, because given what you were sharing in terms of the update before, there's a lot more engagement going on, but are these actual directly coming to us through our office space, or is this when we're going out and doing our contacts as well? Is it from both sources?
Yeah, I'm looking at Claire, but she can't tell. Claire, that is from both sources. I'm right in saying that.
This is everything that we receive. So whether that's through the website, phone, email, or face-to-face, and we pull it all together in our system and then see what our themes are, what everybody's saying on the whole.
That's useful to know. Right, thanks very much. Well, as I say, I welcome it, and it gives us a feeling of the things that will be coming through and that we might need to concentrate on as we're going forward as well. That's helpful. Thanks very much. I like the visual presentation of it as well, but I'm sure we'll seek other people's views at another point. Thanks very much. Shall we go on to the next Right. Oh, any other business? Is any other business? We've gone quite well today. It's not we're usually on time. All right. No. Well, thanks very much indeed, everybody. And we'll just record the fact that the next meeting should be taking place on Thursday, the 15th of December, between 2 and 3:30. Thank you very much. And bye. And see you all again soon.
Bye, everyone.
Bye.
Thank you. Bye.
Yeah. Catch you soon.
5 minutes.
Yeah, 5 minutes. Thank you.